Thank you very much, Yancy. And thank you for this wonderful opportunity. I see a hands up from Dr. Espany. I don't know if you'd like to attend to them first.
No, that is a previous hand.
Oh, okay.
You may go ahead.
Sorry, it was a legacy hand.
Thank you.
Thank you. And I would like to thank everyone for actually attending this session and for still being here. Can you see my slides, Ansi?
Yes, I can see it clearly.
Can you see them clearly? Okay. So my name is Babatyi Malope-Kgokong, and I'm the National Manager for Academic Affairs and Research. And I'll be talking on the RDI challenges in the public health sector with focus on the National Health Laboratory service. So just as a background, the NHLS function is to provide cost-effective and efficient health laboratory service to support health research and training. So we have a triple mandate, which is diagnostic service, which is the core. We also train for health science, mainly pathology and public health and occupational health. And we also are supposed to be supporting research. We were established in 2000, in year 2000, through the National Health Laboratory Service Act. We are the sole provider of diagnostic service in the country. So we therefore serve 80% of the South African population. So it will be 80% of the 60 million plus South African population. We employ 8,000 staff, and we have laboratories in all 9 South African provinces. And we are very important to the South African healthcare system because of our role as the sole provider. We also just want to make everyone aware that in addition, NHLS has subsidiaries or institutes, the NICD, which most people may be familiar with as part of the NHLS, the National Institute for Occupational Health is also part of the NHLS, the Forensic Chemistry Laboratories, which were recently acquired as part of the NHLS. We also have the South African Vaccine Products, which we are the only Southern African producer of equine antivenoms for snake bites, spider, and scorpion stings. And we also have the media diagnostic product, which is part of the NHLS. Just an overview of how big the NHLS is, as indicated. You find us nationally, everywhere in the country. We are in 422 public hospitals. We actually service 3,841 public clinics, and overall we have 233 diagnostic and clinical laboratories across the country. And we are in all the 9 provinces, and we're serving about 16 million South Africans. And our values as the NHLS, I think what's important to this topic, we strive for transformation, we strive for service excellence, we also want to lead in innovation and continuous improvement. Obviously, we want to be in a situation where we provide excellent diagnostic intervention, and also we are improving the clinical interventions for all the public health sector patients. Also, what is important is that as the NHLS, we are actually in partnership with the 11 South African medical universities. So for the schools of pathology within these medical universities, we employ the head of departments, we employ pathologists and medical scientists who are joint appointed staff between the university and the NHLS. And therefore, our staff are expected to provide service, they're expected to teach and train, and they're also expected to conduct research. And then in addition, we also have formal partnership with the 6 universities of technology and 2 comprehensive universities, which will be the University of Johannesburg and the Nelson Mandela University. So what are our key concerns when it comes to RD&I? I think I've already indicated that our staff, they actually have to provide diagnostic laboratory service. They actually have to do teaching and training. And this they have to do because we have to make sure that we provide the service to the patients and the clinicians. We have to make sure that our trainees are taught. And then our third mandate, which is research, development, and innovation, is therefore compromised. It's not prioritized. And also as the institution, it's not really incentivized. So it's not really attractive to the researchers. And also our leadership, obviously, they sometimes are bound to make decisions between laboratory service, teaching and training, and research, development, and innovation. And you find that research is actually, I always, being the head of academic affairs and research, I always find that research is the third priority amongst the 3. And therefore, we actually need top-down approach and clear goals and direction on research, because it's clear what everyone is expected to do on the service platform and the training platform. But when it comes to research, we need to make sure that the direction is also as clear and the expectation is also as vivid to everyone. We need a clear innovation strategy, which is linked. I also had the previous speaker talking about key performance indicators for research and innovation. Because if these are not properly linked, then it also is not priority or it's not going to be prioritized. We also need innovation dedicated trainings and inductions. I think we still come from a culture of conducting research, but actually we're still trying to understand what is innovation, and especially because it's not incentivized, is it really important to do that? And also, how do I move from my research mode to the innovation and technology transfer mode? We also need active engagement to encourage inclusive innovation think tanks and follow-ups and policy adaptations. And what is important, I also heard it was mentioned, is flexible and diverse funding approaches. And this is not only talking to us as an institution, but also it's talking to funders out there. Because currently we know that research is really funding, it's specialized, and which actually restricts creativity, and it's very specific to the outcome. So what are the current general challenges that we see? I thought we've spoken about lots of challenges on innovation holistically. And one of the key things I wanted to zoom into the institution, and which I think is also a challenge with the public sector, is inflexible HR and procurement processes. Especially with the NHLS, we have service, we have teaching and training as core. And now our policies are focusing on the service platform, and they're really not flexible to research and innovation. So what happens is that we have to follow the standard PFNA, we have to follow the standard HR policies and practices. And one of the key things is that you find that when it comes to research, which it has to happen now, commitments on procurement and recruitment of staff and turnaround time are very uncertain. So even when you put an application, you never really know if you will have a staff member in the next 2 months or in the next 3 months. We have a misconception in deviation because we are solely focused most of the time on procurement for service. Procurement for research and innovation is not really understood. So what happens is that if you have a specific project which requires product A, procurement is still wanting you to get quotations for product A and product B and product C so that you can meet the PFMA requirements. So we find that lots of sole supplier deviations have to be done by researchers, which actually leads to delays in procurement. We also find that what we think is supposed to be an urgent procurement or HR request, it's actually not being prioritized because it's service first and then everything else comes later. And then we also find that there is communication breakdown because most of those who are providing service to us, they are focused on the lab diagnostics and they are not understanding the research side of things. And you find that whatever you say may not be understood, So while we see the 6, they will be looking at the 9, and this is very confusing to us. So also with HR, we know that with research, we actually have short funding opportunities. So there is increased skilled talent turnover. This can be controlled by proper planning, by policies, but our policy are not flexible enough for you to circulate the stuff which you're already having. If the contract ends and you're still waiting for additional funding, then the contract will be terminated. So it means you actually will have a talent void because what happens is that you are continuously on a rotating recruitment phase where everyone who is there, it's been circulated and you get new staff almost every 12 months, depending on the project. And also it means you are attracting less experienced talent because experienced people don't want to be in short contracts, and they also don't want to be, to always be looking whether to worry about whether their contracts will be extended or not. And also, I think this also leads to skill transfer limitation because what happens is you train somebody this year for 3 months of probation, they work for 9 months, and then you have to train somebody else. So what are we trying to do? We are trying to communicate with our support departments and to say, there are clear facts about funding, especially grant funding and RDI. PFMA and HR policies, which we have to follow strictly, are not research and innovation friendly. And why? Because, for example, grants funding is usually provided for short periods, which, in most, it will be 12 months, it will be 36 months, and if you are lucky, it will be 60 months. And we have to make sure that during that period, the principal investigators are pressurized to spend the funds and to complete their projects within the awarded period. But also, our policies do not allow for you to initiate maybe HR and procurement processes before funds are approved and granted. So because of that, obviously, it means you will have delayed procurement and recruitment processes, which leads to projects not completed timely and project targets not met. Requests for award extension or carryovers that has to go to grantors. They are also dependent on grantor turnaround times, and also it depends on grantor regulations. Some may approve the extensions and some may not approve the carryover of funds. Grantor refunds, if the funds are received in advance, you may have to be returning those funds, and some grantors will also say we want the end interest to be returned. And also organizational reputation. So if our policies are not flexible, if our PFMA, we don't see how we can align appropriately with it to fit RDI, then obviously in some of the research projects, we are not meeting the objective on time. We always have this reputation of late objectives being met, and obviously organizational reputation is affected. And also we are seeing declining in PI confidence. So because we have most of our staff who are conducting research as joint appointed staff, then most of them, if they can, will move the funds to the university because they have better turnaround time and they also have flexible policies. So some of the interventions which I think we have to actually, from the planning of our research, talking to the researchers, talking to the grantors, talking to the research support officers, and actually talking to leadership, is that we need proper planning and scheduling. And what is important is we realize that we focus on submitting the proposal, submitting the grant application, but then you'll find that even when targets are set and timelines, they are not really clear. And also we are not considering setbacks. So even if we know that we may not hire somebody in 3 months, we are not saying, what am I going to do during this period? We are planning as if it will happen as it's supposed to be. But also we need to make sure that we have extensive progress tracking, because during that period, as you track progress, as you note that there are some things that don't work the same way, we have to be immediately reactive. And then obviously supply chain management, we need to build relationships. We need to make sure that we communicate effectively with them. We need to make sure that they understand the reason why they have to be flexible. But what is important, they need to be very responsive, and they need to understand why, especially in our scenario where they think that because you are research, we have to prioritize the patients. And then what is important also is contingency plan, just in case scenario. So if this does not go this way, what is my plan B? And this is one of the things that researchers have to do and innovators have to do from the beginning. Because if you don't include the contingency in your application, our funding is not flexible enough to actually accommodate that contingency. And we have to make sure that we think beyond what we think is normal. I think we all know of the current NHLS situation. We've been cyber attacked, and because of that, it affected our service, but obviously it also affected research. And because there are several students, there are several organizations who are depending on us to supply some of the materials, some of the data for them to conduct research. And one of the things that we have to learn is risk management and risk mitigation. If this happens, what am I going to do if something goes wrong? And in this, I think I'm in a situation where we are at, it went wrong, then what? And you have to make sure that there's a clear plan. And this is what everyone has to be taking in consideration. And the next thing is the institution having now being aware of the situation. What are we doing? As the NHLS, we know that we are supposed to support research as one of our mandate. So one of the things that we are doing, in training and development, we are actually training recently at least 50 medical scientists, and we recruit new 50 medical scientists in 10 every year, and we're recruiting at least more than 60 pathology registrars every year. But also what we do, we also have a virtual training platform, ECHO, and we have set platforms across the country, and there's 93 sites nationally across the NHLS laboratories. And through this, we are offering CPD accredited sessions annually, and we've been offering more than 230 sessions in pathology, in diagnostics, in research, in public health and occupational health annually. We have trained more than 2,000 people since 2018, and we also have dedicated RDI sessions. As an NHLS also, we are making resource accessible for researchers. Whether you are an NHLS staff member or you are external, you can request access to de-identified leftover samples for your research. You can request access for anonymized data for research, which is where I'm saying most, you'll find that there are students and researchers who are affected by our current system down. We also are encouraging collaborative opportunities with NHLS experts. And what happens is you can come through our office and we will provide direct links to you. And we will find the direct links across all the universities that we have partnership with. And also applications can be submitted on our ARMS portal, which is accessible externally. I could not provide the address for now because our ARMS portal is currently not active. So we are also very open to partnerships. We obviously are working in university multi and inter-collaborations, but we also work with Science Council, the CSIR, HSRC, SAFC, and many more. We also work with NGOs, Caprisa, Right to Care, Vessel Consortium, and we also work with international collaborators. So this is just the research material and data access that we get annually. We introduced our ARMS system around 2019. And since then, we've been receiving on average about 300 applications, either to access samples or leftover samples or to access our data for research, and all the applications are done through the ARMS portal. And in terms of our research output, we are publishing about, in average, more than 600 publications. And for this year, our publication output was a little bit low. We can see that 2021, we had a peak. We're thinking this, actually not thinking, these were mainly COVID publications, and we saw the decline in COVID publications, but we were hoping that we will actually peak for this year. And we are still trying to understand why we have this decline, but we are thinking it may have been the COVID effect, but also we are thinking it may be the innovation effect, because we have been trying to promote innovation with our researchers and asking them to take their time before they publish. We know that most of our old researchers are not happy with that because they want immediate, satisfaction of I have published, instead of waiting years without knowing what's going to happen. So overall, we had more than 3,000 journal publications in 5 years, but our innovation drive is still low. We had 2 innovation disclosures, and we had 2 patents in collaboration with UKZN, and the second one was in collaboration with Caprisa and 2 USA institutions. And in addition, we also have a PathReg Congress, which is held every 2 years. It's mainly pathology and public health research. And in the last 2023 Congress, we had more than 1,000 actually attendees and registered people. So we had about 97% attendance, and we had more than 312 submitted abstracts, and majority of those abstracts were from NHLS researchers and NHLS collaborators. So what does the NHLS do to try and drive RDI within the institutions? So one is providing funding opportunities. And one of the things is that we have negotiated with the NHLS Research Trust, and they have approved a pathology doctoral support fellowship, which is 1.5 million and will be introduced by end of this year. So this is to offer pathology time off to go and do research. And then also we have multidisciplinary pathology collaborative program, which involves 3 institutions, and one of those institutions have to be an HDI, and this will also be introduced by end of this year. And we also have a few funding opportunities to just kickstart the young and upcoming researchers within the NHLS and encourage them to understand and be able to submit to kickstart their own grant application processes. And also, we are looking into improving research development support. And what have we done is now, from this year, we actually hired grant-specific procurement staff. So we have 3 staff members who are only focusing on grant supply chain management and making sure that they are trying to actually make procurement understand the researchers' needs. And we are seeing this being very effective. We've also placed a grant-specific human resource staff who is only focusing on grant recruitments and not competing with the overall NHLS service and training recruitments. And we're strengthening our grants program unit and our grants finance unit. And through the NIPMO, we are thankful that we are actually strengthening our technology transfer. And also, in terms of funding, our grants management unit is actually managing funds between 700,000 to 1 billion annually. But of concern is that 24% of this is international funding, 25% is local funding, and only 1% is from the institution. And obviously, if you want to drive specific objectives or specific goals on research, then we really need to strengthen our local funding and our institutional funding, because in this case, we are driven by what the grant hosts want you to do. And within the NHLS also, we have bodies. We have a research development committee of the board, which is only making sure that the research mandate of the NHLS is delivered. And we have the strategic research and innovation plan, and we have policies for RDI, and the specific unit academic affairs and research, which is now focusing on research and development. So in conclusion, from my side, I think we have spoken a lot about innovation and the setbacks. But I think what is important is that we need the flexible funding opportunities. These have to be diverse. We need grantor to understand if we're to innovate. Sometimes ideas changes halfway. We need innovation skills to be developed, but also we need buy-in. We need researchers to know that they have to be focusing on innovation than focusing on publication. And this is our case as the NHLS. We actually need open minds of everyone here to multidisciplinary and multi-institutional partnerships. I've indicated we do have partners with NGOs and Science Council, but negotiations takes long because we see non-flexibility when it comes to IP sharing, because everyone wants it to be mine. But if we want to be in partnerships, then the idea of IP sharing has to be clear and has to be transparent. And also, we need to make sure that we have effective collaboration. And as the NHLS, we actually are calling towards any collaborators who are working towards the enhancement of laboratory diagnostic, clinical intervention, and service, laboratory service efficiencies. We are happy to welcome you and to work with you. And we're just hoping that whoever comes, it will not take us 6 to 12 months to actually conclude a contract. And what is important for the NHLS is institutional rethinking on how to drive innovation and to promote research translation. Thank you very much, Yancy.